Hello, welcome to Aging Well in America. I'm Anne-Marie Gattari, your host. It's been a year since we've started Aging Well in America on our cable show here at the War Memorial, and I'm very pleased. We've had a lot of exciting guests on. We have more to come this year. Every day, 10,000 people in the United States turn 65 years old, and by the year 2050, there will be 20 million people who are aged 85 or older. Today that number is only 5.5, so imagine 20 million people who will be older than 85 years old. Are we ready? Is society ready? There's a lot of really good work going on around the country, around the world really, and right here in our own community. And I have with us today another one of those people who is doing much of that good work, and her name is Kristin Clark.
Hi.
Hello, Kristin.
Nice to meet you.
Welcome, welcome. Kristin is with Henry Ford Medical Center at Cottage Hospital and is an acupuncturist among other integrative medicine disciplines. But today you came to speak with us about acupuncture. Tell us a little bit, though, before we get into the needle part of things, tell us a little bit about the Integrative Medicine Center at Henry Ford.
The Center for Integrative Medicine at Henry Ford has been at Henry Ford Medical Center Novi for the last 12 years and has recently started at Cottage in Grosse, Pointe for the last 3.
Okay.
And we've been offering acupuncture there for the last year.
And in addition to acupuncture, I believe you also offer chiropractic services as well?
That's correct.
Yeah. So how is acupuncture used by specifically our audience, the people we're speaking to, the elderly, the seniors? I'm thinking that it may have taken a little bit to convince some people to give it a try, but what has been your experience?
Absolutely. At Henry Ford Medical Center Cottage, we have an opportunity to be in such close proximity to the assessment center. So by virtue of that, we do see
the assessment center. That's the senior assessment center at right there on the 3rd floor.
Correct.
At the hospital, where seniors can go for a full medical 4-hour assessment, as I recall, with a medical doctor, physical occupational therapy pharmacist, and a social worker.
Yes.
So just to give that a little plug.
Yes.
And then you're in very close proximity, and there's some cross references and referrals.
Especially in the elderly population, they benefit quite a bit from acupuncture, especially in cases of chronic pain or depression. So that's commonly what a lot of people come in for, or a lot of people recovering from surgery. Acupuncture is a really great tool to have, just kind of to recover a little bit faster.
Yes, yes. How is that? How does it work? Can you tell us in lay person's terms how acupuncture can help with pain or depression or even a specific disease?
You know, the actual mechanism of how acupuncture works isn't really known, unfortunately.
Is that right?
But we do know that it's multifactorial. So based in my practice and in the practice in China over 3,000 millennia of taking care of people,
yes,
we do know that it's very effective at treating these things, especially in things that have historically been difficult to treat from a Western standpoint, especially chronic pain and things like that. So we get a lot of referrals from people, especially with the barrage of medications that most of our elderly population is on. Getting them in for acupuncture often helps them to kind of reassess and sort of, you know, with the work of their doctors, has helped them to wean off of certain medications, or if they don't want to take another narcotic, or they're starting to develop a sort of tolerance to certain medications, then acupuncture can be very beneficial.
Do you work with other primary care physicians?
Yes, and
you do.
At Henry Ford Medical Center Cottage, we do have reproductive medicine. We have a couple. We just started doing chemotherapy there. So I do see a lot of those patients, kind of cross-referring for those patients to help alleviate their discomfort.
Yeah. Tell us a couple stories. Tell us about a couple people who have come in for one thing and what the outcome was.
A lot of people coming into me at Henry Ford Medical Center Cottage come to me for recovery after surgery, let's say. So there was one woman that came in for a herniated disc. She had a herniated disc repair and she couldn't get out of bed. And it was very difficult for her to move around. But with a couple treatments, she was able to move around a little bit better, recover a lot faster, stop taking her medication a little bit sooner.
Really?
And actually, I didn't know this, but she had insomnia for whatever reason. We didn't really talk about it, but that was steadily getting better. She was like, by the way, I've been sleeping a lot better, and I didn't know if you had worked on that or not, but just by virtue of helping somebody kind of balance their system and balance their energy, then they can feel a lot better and sleep a lot better, or a lot of things get better that you might not have come in for treatment for.
I see. Is the treatment the same for everybody? I mean, do you go through the whole body, or is it specific per issue?
It's pretty specific. Some of the beauty of acupuncture and oriental medicine is that 10 people can come in with the same condition and they're all treated differently.
They are.
They all get different points because it's just totally different for everybody. It's not just one thing for each condition. It's different because you look at the whole person. You look at the whole body.
Yeah.
And that's part of the beauty
How
of it.
does it work? So I call the center. I'm having trouble with, say I have, chronic pain in a part of my my shoulder, or a very common thing is a fall, right? An elderly person
Right.
will have fallen and either broken a femur or a part, a hip, even an arm. What's the process?
As far as the process, if you come in for a first treatment, then we would do a full assessment, and I would diagnose you based on what my Chinese medical principles are, and kind of go through what the treatments are going to look like. Whether I say you come in once a week or once every 2 weeks, just depending on how severe the complication is. And hopefully then I'll kind of tell you what to expect at each stage. And then hopefully as you start feeling better, then you can come in for less treatments. I mean,
I see.
acupuncture was started as a preventative treatment.
Mm-hmm.
And so with doing that, hopefully then you only come see me for a maintenance and for prevention
I see. Okay.
rather than for an actual problem.
Okay. You mentioned the word preventative, and I know that is something that the center is the Center for Integrative Medicine at Henry Ford Cottage is really focusing on these days. There are so many mainstream medical facilities and private physicians are. Acupuncture, of course, is a big part of that prevention. Tell me how it all works together, and do you see how are doctors in the hospital and in the community using acupuncture?
Acupuncture, did start out as a preventative treatment. So, especially with the model that Henry Ford is starting to adopt, where they're starting to sort of emphasize preventative medicine, becoming a little bit more about sort of wellness in the whole person. So, especially with this phenomenon of the revolving door, that we get a lot of people just kind of coming in for readmittance to the hospital, or coming in and getting another medication, or another referral to a specialist, or another surgery. So, kind of stopping that in its tracks and sort of coming back before people start to feel discomfort, and actually getting the treatments in is becoming more and more common, and especially since patients need options. Patients need outcomes. Patient needs treatment. And practitioners, especially doctors, really like having the option for their patients rather than going into a more standardized, maybe frustrating route, and into a more sort of holistic, gentler and safe approach.
Yeah. Are there, do you find that doctors in general are more open and more willing to recommend something like acupuncture for their patients?
Absolutely, yes, absolutely, because they know that it's safe, and the side effects more than outweigh the risks of getting an acupuncture treatment, especially with the new generation of medical students that are graduating from medical school, getting a lot more exposure to complementary therapies.
Yeah, that's true. I would think that with medical schools being so much more broad in their focus these days, that you're going to see more and more of that. Yeah. So you've got a real partnership going with many doctors, I would think.
Yes, and it's great. It's really, everybody wins.
Yeah, that's great. You also mentioned your Chinese studies. You were telling me before we started that you'd spent some time in China on an internship. Tell us about that.
Oh, it was amazing. And in China, there are Western hospitals, and then there are traditional Chinese medicine hospitals where you get acupuncture every day, and you are getting herbal IV drips, and it's just fantastic. So I got the opportunity to rotate through a couple hospitals there, especially in people that were suffering from stroke, and rehabilitating there with acupuncture instead of more traditional means, and saw some really just sort of amazing things along the way.
Like what? Tell us a story.
You know, one of the patients was getting a Tui Na, what we call a Tui Na massage, which is a massage that I practice from learning.
And what is that word again?
It's called Tui Na, Tuina.
Okay, and what does it mean?
It means push-pull.
Push-pull, okay.
And that's kind of more the mechanism that you actually do when performing
in that
massage.
type of massage, okay.
And they were getting treated, and there was a little boy that got treated with his lockjaw, and his jaw actually opened after the treatment, which was just kind of fascinating and kind of terrifying at the same time.
Yeah, really. Why was it terrifying?
Oh, it's just it's very vigorous massage.
Oh, I see.
But it was without a lot more intervention, and the kid just kind of walked off and felt a lot better. So
Isn't
that was
amazing.
Yeah, it was
no
amazing.
Surgery, no meds, no. Yeah.
Yeah.
Not that there's not a place for that, of course.
Of course.
But it's nice when it is all integrated and works together.
Yes.
You're going to, you've brought some needles here, I see.
I did bring some needles.
Yeah, okay. It looks like we've got a little OR action going on here. Okay, what do you want to do to me?
So, I will, I'll place a needle kind of in your hand, but this is, I don't know if you can really see it, but needles are very tiny. They're about 30 to 40 of them can fit inside a standard hypodermic that you get your blood drawn with, so they're very painless. A lot of people don't describe. You might feel a little sensation of the needle going in, but typically people wouldn't describe it as a painful sensation.
Okay, here you can show your needle here if you'd like. Just
see.
We've got
you have this one?
a little close up there. There you go. Yep.
Yep.
Just point it toward. Yeah.
Yeah.
So it is. It's almost like the finest of fine sewing needles, almost like a sewing machine needle.
Yes,
right?
but if you poke yourself
finer.
with it, it doesn't really hurt that bad.
And it's very pliable. It's soft.
They're very flexible. Actually, I'll show you one with this one.
Okay. So what? Oh my.
So they're very flexible. Yeah.
Yeah, you can barely see it. Here, let's hold it up. If you can. Yeah. All right.
Yeah.
So what?
They're super fine.
What are you going to do here?
So if you want to just lay your hand
on
here.
All right. Can you get that, Lauren?
That's just about it.
Okay, so
that's pretty much as bad as it gets.
What are you doing? What are we accomplishing here?
This is just kind of a convenient point to do, but this is a very common point that we do in traditional Chinese medicine. And so it's just sort of you just kind of place the needle in, and it's just kind of, you're going to sit there for about half an hour if this were a typical treatment, and then I would take it out, and then you would go on your way.
Now, in a typical treatment, you would do many needles at a time, right?
So usually about 10 to 20, just depending.
And what's going on here in my hand specifically? I feel it getting almost hot, tingly.
Yes, a lot of people kind of notice the tingly or even a dull, almost heavy sensation.
Yeah.
But some of the meridian pathways, so the acupuncture points lie on sort of energetic pathways in the body. And the one that is running on you is actually kind of going all the way up your arm. So we use it for pain. It also kind of opens up the face. So if somebody's coming in for headache, then that's usually a good point to do.
Really? Okay.
And it also is really good at kind of just moving and opening energy. This is actually one of the first points that we learn in Chinese medical school. Yeah.
So this little point right at the base of my forefinger can do anything from help with headaches to various pain.
Yes, a lot of pain.
Shoulder, back, or anywhere.
Yeah, especially headache pain, especially
Okay,
head pain, because
okay.
it kind of focuses its treatment sort of up on the
Okay.
face.
Well, that's pretty relevant because I do, on occasion,
Get some
have a
headaches?
headache that I find bothersome.
Yeah.
Interesting.
And then when I take it out,
And that's it. So I don't know why I anticipated it like standing up and being.
sometimes they stand up, just depending. I mean, because sometimes you might put it in, especially for a muscular pain, you might put it into the muscle. So, but yeah, there's no
Very
hole.
cool.
There's no.
No,
Yeah.
there's nothing. There's nothing. But it would stay in typically for a half hour or so.
Yes.
Okay.
It's just about around half hour, depending on the treatment, to
Now,
45 minutes.
Will that couple of minutes, should I expect to feel any different later?
You might. A lot of people walk away the first treatment kind of noticing a change, at least a better sense of well-being. A lot of people feel very relaxed
Really?
after the treatment. At the most fundamental level, the acupuncture needles decrease the stress response. So, with more research, we know the physiology of stress is probably the root of a lot of disease that we know in Western medicine. So, by doing that, it's pretty profound on what the implications are for further study and research as far as acupuncture goes.
Now, of all of the integrative medicines, chiropractic, acupuncture, even the massage therapy, Reiki, you mentioned one that you do with herbs.
Yes.
And then, of course, we mentioned massage. Is there a rating of those that are most effective if you're a senior, if you're elderly, if you're one of in that age group that I mentioned earlier, and you've got serious things going on, and you don't have, you don't have a lot of time nor will, quite frankly, to experiment with all of them. Is there one that you'd say, go get this, this is going to make an impact and you're going to feel it
I'm not really an expert on any of the other modalities. I just specifically work in traditional Chinese medicine acupuncture, but, as far as that goes, people that are suffering can, benefit from acupuncture. I mean, just really just to give it a shot. And 6 to 8 treatments until you really know, until you probably start to feel a lot better.
Right.
And then coming in for maintenance, I mean, that's, preventative care in and of itself is pretty compelling to.
Sure.
And so, taking that investment in yourself to feel better is, I think is really beneficial. And I feel like, it's safe. There's not really a lot of side effects. Bruise is pretty much the biggest side effect that I've seen. So really, you really have nothing to lose really by trying it out and starting to feel better, at least a little bit better, at least feeling like you have a better sense of well-being.
Yeah. Depression is often a big one that we hear with the elderly who, have to come to grips with their own limitations and the fact that now they may need help and they feel their independence is being encroached upon. How does acupuncture help with depression? And how do you treat it specifically?
Depression in traditional Chinese medicine, it's, we have a sense of the emotions kind of being a cause of disease, and depression is very, it doesn't help people get out of bed. It doesn't really help people to live their normal lives. So by promoting a general more sense of well-being in somebody and decreasing the stress response and helping them to live fuller lives, and helping somebody to feel better, and having another advocate on their health team, maybe just by seeing an acupuncturist helps them to just sort of know that somebody is kind of on their side.
Yeah, that's a very good point.
Can really help.
Yeah, that's a good point. Talk about some of the other disciplines or modalities, as you referred to them, that you practice.
So yeah, acupuncture is probably the most common one. A lot of people, get the image of sort of the pin cushion in their head. And herbology is something that I also do. There's an extensive herbal medicine in China.
And what is that? Talk to us about that a bit. What does that entail?
Herbal medicine is kind of the pharmaceutical part of acupuncture, really. I mean, herbs
Are the herbs actually in pill form that people take?
Most of the time. Sometimes you can get raw herbs or you can get little granules that you kind of put in water and dissolve.
Okay.
But what we use at Henry Ford Medical Center Cottage are normally in pill form, which are easier to take. And so that is, it's quite extensive. There's a lot of research, a lot of, 3 millennia of history of, using herbs. And
Can you give us an example of one or two that might be used for a common ailment?
especially nowadays, ginger is a really common herb in traditional Chinese medicine. Licorice root is a really common herb. Cinnamon is really common. So some things are kind of in your spice
And
rack.
taken for...
Especially the ginger and cinnamon are taken for more kind of cold type disorders. So
Oh, is that right?
Yeah, so say you have a pain that's a little bit worse than the cold weather, then usually those herbs will be used, especially in the wintertime, to kind of warm people up.
So I'm assuming that just using a lot of cinnamon or ginger on your food is not going to do it.
No.
It takes a lot more than that.
Right, yeah, it takes a lot more than that. And there's also really, herbal medicine is very, combining the herbs is it's kind of an art in and of itself.
I see.
To sort of, compile the formulas and give it to somebody, which is why, getting an assessment from somebody first is usually
important.
A bit better.
Yeah, okay. What else do you do? You mentioned something called cupping.
Cupping, yes. I don't know if anybody remembers the Gwyneth Paltrow cupping marks from the Oscars. But that's actually what got me, part of the reason why I got into acupuncture. It's sort of a treatment to alleviate pain, and a lot of people use it for detox, especially in weight loss treatments.
Okay.
So that is usually used to alleviate pain, and sometimes it's using a kind of a cup on the skin. It's a type of massage. You can kind of call it massage, but it's
And
a
how
little bit
exactly is it done? What kind of cup is used?
Traditionally, you use a glass cup, and then you put a match inside, or just something, a flame inside to get rid of the oxygen.
Is that what those marks were on her back?
Yes, the kind of, they were almost like suction marks.
Oh, I see.
Okay.
Okay.
But that's kind of, when we look at the really dark purple marks, we know that you've got a lot of toxins out.
So
So
and then those go away, of
Yes,
course.
yeah. It's very exciting, though, when you get a really nice mark.
It is. It's something you wear like a badge of honor.
Yeah, you know that it's something really bad came out.
It's gone.
It's gone, yeah.
This was the exit. This was the door.
Yes.
Oh, that's interesting. Where do you practice, Kristin, outside of the hospital?
I have a private practice in southeastern Michigan as well, but
Okay.
But Henry Ford, I practiced at Henry Ford Medical Center Cottage on Tuesdays and Thursdays.
Okay, Tuesdays and Thursdays, so they can call and make an appointment with you. You want to? I will have the phone number, of course. There's your email and your phone number. I think we have that as well. Do you want to give that to us?
Yes, the phone number is 248-380-6201.
248-380-6201.
6201.
Okay.
And feel free to email me and ask me any questions. I love answering questions.
Okay, I bet.
Yes.
Do you have a website, a blog? Is there a way people can follow you and follow your work and your research that you're following and your discoveries?
Not as of yet, but you can go to the Henry Ford website, and hopefully something will be coming up soon.
There are that website is terrific. There's a lot of very, very cool things going on there. So before we wrap up, I really wanted to give you an opportunity to tell us a little bit about yourself, how you got into this, and what drew you to this realm, and where you studied.
Specifically for me, my journey kind of started with, I had a shoulder issue, and I had juvenile rheumatoid arthritis.
Oh, really?
So
and what was that like? How did that? What was the impact of that on your daily life?
When I was younger, I barely went to school. I was in a wheelchair for one summer.
Really?
And
how old were you?
I was 11. And then going through alternative therapies, or I should say complementary therapies, really helps me out. But acupuncture especially was what really got me to feel better and actually function and go to school.
Oh, that's amazing. So your parents were open-minded enough to seek this treatment.
They were looking for anything to make me feel better. And my only really regret is that they didn't try that out earlier.
Sooner,
first,
but how would they have known you were 11?
But
wow.
Yeah, but that was great. So that's when I knew exactly what I wanted to do right after that, because my results were so compelling and so profound. And so, it just continues to be like that every day for me.
So do you still suffer from from the arthritis?
No, luckily that's all.
It's all gone.
It's all resolved.
Isn't that wonderful?
Yep.
Wow, that's amazing. That's quite a story.
Yes, yeah.
So then you went on to study where?
I went to Chicago at Pacific College of Oriental Medicine, and I did that for 4 years, and I got my master's of traditional Oriental medicine there.
Okay.
And then a couple years after graduation, I went to China.
I see.
And did some special training there.
Okay. And do you follow a traditional Chinese diet as well?
I do, yeah, I try to. I mean, it's kind of impossible not to think in those terms sometimes because you're kind of, you just realize that you can't eat a certain thing because you know how your body works. So which is, more of a benefit than really anything. So I stay pretty healthy.
Yeah, very good, very good. Have you, who in your family would you say, I'm thinking of maybe you have an elderly grandparent or an aunt or uncle or even maybe your parents who were absolutely opposed to this, thought it was, had no value, saw it as almost nonsense, and you were able to turn them around with a treatment or two. Do you have that example in your own family?
Yes, when my mother and father, of course, were, very pro this medicine as they saw the results for me.
Sure.
But when my aunt got diagnosed with pancreatic cancer. And so while she was going through treatments, I offered her treatments. I came up to her and I said, you really have nothing to lose. I have needles, I will treat. And so after a couple of treatments, she noticed that she was able to get up and move a little bit more after her chemo radiation to sort of spend more time with her family and eat a little bit better. So that was rewarding. And afterwards, she became kind of a believer.
Isn't that amazing? What a wonderful, wonderful story that you have. You have many of them, and it's been a pleasure to have you with us, Kristin.
Thank you. It's a
Thank you
pleasure
so
to be
much
here.
for coming.
Thank you.
Thank you. Well, we've come to the end of our half hour. I'd like to thank our viewers. Please continue to send us your ideas and contact us with those you'd like to see interviewed here on Aging Well in America. You can contact us here at the Grosse Pointe War Memorial. Thank you. Okay.
All right.